Hello, this is the daily COVID update from Deccan Herald. I am Akhil. On the bulletin today, Karnataka reports 12 new cases of COVID-19. Karnataka is set to change its containment strategy. The central government will allow movement of stranded persons, albeit with some restriction. And Nitin joins us to bust the top fake news of the week. But first, let's take a look at the national numbers now. At the time of this recording, nearly 33,000 cases have been reported from the country so far. More than 23,000 people are active carriers of the virus. Over 8,000 patients have recovered since they were first tested, and the country's death toll has crossed 1,000. The Indian Council of Medical Research has collected more than 7 lakh samples for testing from across the country so far. Maharashtra has reported 597 cases, and the number of active cases in the state is almost 8,000. Gujarat has reported 308 new cases, with the total number of active carriers of the virus in the state crossing 3,000. Delhi, Madhya Pradesh, Andhra Pradesh, and Rajasthan are close behind. Karnataka is in the 13th place. Karnataka has reported 12 new cases today. Out of 297 active cases, 7 are in the ICU. The number of people discharged stands at 216. The number of deaths has risen to 21. Out of 12 new cases reported today, 8 are from Kalaburgi. Belgavi, Davangere, Mysore, and Tumkuru have reported 1 case each, except patient 533 from Davangere and patient 535 from Tumkuru, who presented with influenza-like illness and SARS respectively. The remaining 10 cases have been contacts of previously identified COVID cases. Patient 535, a 73-year-old man from Tumkuru with a complaint of SARS and a past history of respiratory disease, diabetes, and asthma, has passed away today. In national news, in what is good news for migrant workers, students, tourists, and others stranded in various parts of the country because of the lockdown, the center is making preparations to relocate them to their hometowns. The Ministry of Home Affairs has issued an order amending the April 15th revised guidelines on the COVID-19 lockdown, which will allow the movement of stranded persons only if they're found to be asymptomatic after a mandatory screening before the journey. Repatriation will be done using buses, which will be sanitized. Also, social distancing norms will apply within the buses. The order also states that in case a group of stranded people wish to move between states, both the states must consult each other and mutually agree to the movement by road. Those states falling on the transit route will allow the passage of such persons. On arrival at destination, the passengers will be further screened by local health authorities and kept in home quarantine, unless the assessment requires moving them to institutional quarantine. Periodic health checkups will follow. The Supreme Court has directed the center to consider making personal protection equipment available to all healthcare workers engaged in non-COVID treatment, since asymptomatic patients of the viral disease are reported to be on the rise in the country. The PIL was filed by a Nagpur-based doctor who sought the direction from the SC for providing PPEs to all healthcare workers, including doctors, nurses, ward boys, and other medical and paramedical professionals engaged in non-COVID treatment. The central government has asked all of its officers and staff to immediately download the Arogya Setu app to identify the possibility of contracting COVID-19 and review their health status before setting off for the office every day. The Department of Personnel and Training has said that the direction should be strictly followed to improve the safety of all government officials, who should commute to office only when the app shows safe or low-risk status. If the app shows a message that they have a moderate or high risk, employees are advised to stay away from the workplace and self-isolate for 14 days or till the status becomes safe or low risk. The risk assessment is done on the basis of Bluetooth proximity to an infected person. Meantime, the central teams tasked to check preparedness of districts with a high load of coronavirus cases have found that infection prevention control practices are not properly being followed in several hospitals in high caseload districts across the nation. 6 high-level multidisciplinary teams were constituted by the Union Health Ministry to assist and review state health departments for proper implementation of cluster containment plans for large outbreaks and check hospital preparedness for COVID-19. Teams comprising experts from the National Center for Disease Control, AIMS, and ICMR, among others, visited states which have a high caseload, including Gujarat, Maharashtra, Rajasthan, Madhya Pradesh, Uttar Pradesh, Telangana, and Tamil Nadu in between 2nd and 3rd week of April. The teams have reportedly found that infection prevention control practices were not being followed properly during sample collection and the treatment of confirmed cases, raising concerns over the possibility of healthcare workers being infected and leading to further transmission. Among many other suggestions to the state, the teams have recommended the need for proper medical management of mild, moderate, and severe cases, as well as a separate triage area in hospitals to segregate them. As many as 15 places, including Ahmedabad, Delhi, Jaipur, Hyderabad, and Mumbai, have been identified as high caseload districts by the government. The Ministry of Health And Family Welfare has directed state authorities to ensure essential services for tuberculosis patients during the lockdown, including the issuing of exclusive passes for TB patients to enable easy access to TB facilities. The advisory also underlines the importance of delivering the TB service in tandem with COVID-19 measures. The advisory also states that people-centered, outpatient and community-based care should be preferred over hospital treatment for TB patients unless serious conditions require hospitalization. It also advises the authorities to provide adequate TB medicine so that the patients do not have to keep visiting treatment centers. National TB Elimination Program is expected to provide anti-TB drugs for a month and in extremely difficult situations, up to 2 months, to ensure that there is no interruption in treatment. In news from Karnataka, the state government is contemplating revising its COVID-19 containment strategy post-lockdown of assigning red, orange, yellow, and green zones at the district level. Currently, any district that has reported over 15 cases is identified as a red zone. 6 to 14 cases are orange zone, 1 to 5 cases are yellow, and any district with 0 cases is green. As per this classification, there are 6 red districts, 5 orange and yellow districts each, and 14 green districts. This classification is being used to enforce the lockdown measures. However, Revenue Minister R. Ashoka said that after May 3rd, the focus will shift from districts to taluks in order to free up unaffected districts and focus only on the virus-hit taluk. The officials are of the opinion that in each district, most cases are generally originating from only one taluk. So when the same color coding is applied to a taluk map, it is seen that a large part of Karnataka is unaffected by COVID-19. Out of 176 taluks, there are active coronavirus in just 36 taluks. Meantime, just before rebuilding the state's economy after the lockdown, the Karnataka government has ordered for a massive door-to-door survey of every family in the state and identify vulnerable groups in just 5 days. Those with SARI, ILI, and other respiratory diseases fall under vulnerable groups. A mobile app has been developed for a quick understanding of data and to assess the extent of vulnerable groups in real time. The teachers across states have been roped in for the massive exercise. So far, fever was one of the key symptoms of COVID-19, but in a sign of how little is known about the disease, a state-level panel of specialists found that most patients did not have fever. COVID-19 patients presented mainly with cough and breathlessness and a worsening of these symptoms. A panel has been tasked with answering questions like why the mortality rate in Kerala was lesser than in Karnataka. It is also studying the gaps in treatment and how the various district administrations can avoid a delay in initiation of the treatment. Yeah, before we go, it's safe to assume that if there's a crisis at hand, then fake news can't be far behind. My colleague Nitin has been tracking some of the wildest forwards on social media platforms.
SSLC and PUC students in Karnataka are a worried lot, and this particular piece of fake news has led to more confusion among them. BTV News, a Kannada news channel, has said that SSLC and PUC students will be cleared even without having to write exams. This particular picture has been circulating on social media ever since. However, the Education Department has dismissed this. The Karnataka State Police Fact Check has verified this and concluded that BTV News telecast this fake and misleading piece of news. This video from a village in Ramnagara went viral recently. The man in the video is seen announcing that Muslims are prohibited from entering the village. The announcement clearly says that the Gram Panchayat will impose fines of Rs 500 and 1000 if anybody is found working for Muslims. LK Atiq, the Principal Secretary of Rural Development and Panchayat Raj, later clarified that this was an act of minor mischief by a Gram Panchayat member. He also said that the Gram Panchayat itself has no role in the announcement and that a case has been booked against 3 people. However, the mischievous video continues to make the rounds on social media. Stay tuned for more fake news takedowns because unquestioned fake news is as good as the truth.
And finally, at Deccan Herald, we believe that there is kindness to be found even in these dark times. With our Spread Kindness campaign, we hope to bring you stories of ordinary people doing extraordinary work. Ever since the lockdown began, Shanta Narona, a tailor from Talaguppa in Sagar Taluk, hasn't received fresh orders. After learning that face masks are in dire need to prevent COVID-19, the tailor has reportedly spent 30,000 of his own money and has given away more than 3,200 3-layered face masks during the lockdown. Unrestricted by his physical disability, Shantana Narona has been creating awareness about wearing face masks among the villagers. If you wish to help him, reach out to the number on your screen. That's all from me today. Stay safe, spread kindness, and we'll see you tomorrow.